Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, Aleve versus Ibuprofen, what's the difference? One of the most important differences between Aleve and Ibuprofen is the length of time they act for. Ibuprofen is short-acting and is better suited for the treatment of acute pain, whereas Aleve is long-acting and is used for the treatment of chronic conditions. Aleve is more likely than Ibuprofen to cause gastrointestinal, GI, side effects because it is longer-acting. Ibuprofen is also the most appropriate NSAID, nonsteroidal anti-inflammatory drug, for children. Aleve is a brand, trade, name for Naproxen, and Ibuprofen is the drug name of a different NSAID. Common brand names of Ibuprofen include Advil and Motrin IB. Naproxen and Ibuprofen are both NSAIDs, so they are similar in many ways, but there are important differences. Effectiveness of Aleve and Ibuprofen. Aleve and Ibuprofen are called nonselective NSAIDs because they block COX-2 enzymes, involved in pain signaling and inflammation, and also COX-1 enzymes, associated with a protective effect on stomach lining. This makes them effective at relieving pain and reducing inflammation, but there is a risk of stomach-related side effects. As far as effectiveness goes, 440 mg Aleve is approximately equivalent to a 400 mg Ibuprofen. Aleve is long-acting and Ibuprofen is short-acting. Ibuprofen is considered a short-acting NSAID, with a relatively quick onset of action. It is better suited for the treatment of acute pain and is the most appropriate NSAID for children. Ibuprofen tablets/capsules need to be given every 4 to 6 hours. Aleve is considered long-acting, and can be given twice daily. It has a slower onset of effect and is better suited for the treatment of chronic conditions. Aleve is more likely to cause gastrointestinal side effects because it is long-acting. Researchers discovered that the risk of gastrointestinal, GI, side effects such as stomach ulcers and stomach bleeding increases the longer somebody takes NSAIDs. Aleve is more likely than Ibuprofen to cause GI side effects because it is longer-acting. To reduce the risk of GI side effects, NSAIDs should only be taken at their lowest effective dose, for the shortest possible time. Doubling up on NSAIDs, for example taking Aleve and Ibuprofen at the same time, is unnecessary, and to be avoided as it increases the risk of both GI and cardiovascular side effects. If you are prescribed low-dose aspirin to reduce your risk of a heart attack or stroke, then talk to your doctor before taking NSAIDs, as these may negate the protective effects of aspirin. NSAIDs increase the risk of cardiovascular side effects. Another worrying side effect of some NSAIDs is an increased risk of cardiovascular events such as a heart attack. Research has identified that those NSAIDs that have more of a tendency to block COX-2 compared to COX-1 have an increased risk of thrombosis, blood clotting. Aleve, at dosages up to 1000 mg per day, does not appear to be associated with an increased risk of detrimental vascular events, and experts tend to prefer NSAIDs that contain Naproxen for this reason. Low-dose ibuprofen, up to 1200 mg per day, is considered an alternative to Naproxen. However, higher dosages of ibuprofen, up to the recommended maximum of 2400 mg/day, are associated with a higher risk of cardiovascular events. People who have already had a heart attack or stroke must use NSAIDs with caution. One study showed that even 1 or 2 doses of ibuprofen or diclofenac, another NSAID, increased the risk of another event. During the 14 weeks of the study, Naproxen did not appear to increase this risk. However, NSAIDs should not be used after coronary artery bypass graft, CABG, surgery, and all NSAIDs carry a warning that they can increase the risk of cardiovascular events, so should only be used under a doctor's supervision, particularly in people with a history of heart disease. Reassuringly, the risk of a cardiovascular event such as a heart attack, stroke, or death is extremely small when NSAIDs are prescribed for short periods of time, such as for a musculoskeletal injury, in people at low cardiovascular risk. Related questions: can you take ibuprofen if you have COVID-19, coronavirus? Naproxen versus ibuprofen, what's the difference? Meloxicam versus ibuprofen, what's the difference? Other side effects common to all NSAIDs. All NSAIDs have been associated with kidney toxicity and allergic type reactions. NSAIDs also interact with other medications including angiotensin-converting enzyme, ACE, inhibitors, angiotensin II receptor blockers, ARBs, diuretics, clopidogrel, warfarin, dabigatran, and aspirin. Important guidance. When taking any NSAID, the following guidance is given. Acetaminophen is preferred over NSAIDs, when appropriate. If an NSAID is deemed necessary, take only the lowest possible dose for the shortest possible time. Naproxen, in dosages up to 1000 mg/day, and ibuprofen, in dosages up to 1200 mg/day, are the preferred NSAIDs. Ibuprofen is the most appropriate NSAID for children. Avoid using long-acting formulations of NSAIDs as these have a higher risk of GI side effects. Do not take any other NSAID-containing products while being treated with a NSAID. Doctors should review the need for continued NSAID administration at each consultation. In people with pre-existing heart disease or who have suffered a heart attack or stroke, NSAIDs should only be used with caution and only under a doctor's supervision. Older patients, patients with type 2 diabetes or with a history of stomach ulcers, kidney problems or at risk for heart disease are more likely to suffer from NSAID-related complications such as GI side effects, cardiovascular events, and kidney toxicity. NSAIDs should be avoided, but if deemed necessary, their usage should be monitored by a doctor. See also, drugs.com compare tool, Aleve versus ibuprofen, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.